Hello, nice to meet you. I'm Cheung Sung. I would like to say about uh, the vaccine and drug trials are slower to account for safety, but in a pandemic time, it's just money. It's lives. So what shall we do? The trace is on to find treatment for coronavirus. The race is split between the two approaches, the trialing of pre-existing drugs used for similar diseases and the hunt for vaccine. In both instances, important ethical decisions must be made. Is it okay to design a treatment that comes with side effects and with thousands dying from coronavirus every day? Is it acceptable to cut corners in a search for vaccine? Last Friday, the World Health Organization announced the launch of Solidarity, a worldwide trial of four most promising candidate treatment for COVID-19, remdesivir and entire treatment for Ebola, chloroquine, and hydroxychloroquine. Both anti-malarials, ritonavir, and HIV treatment and interferon. A treatment for hepatitis C, both Kaiser Permanent Washington Research Institute in Seattle and China's economy of military medical science last week announced the start of human trials for new possible vaccines. Around 30 other research groups worldwide are working on vaccines. But the WHO estimates that vaccine would not be ready until June 2021. There are requirements that have to be observed. The gold standard for this kind of research is the clinical trial. Administering the vaccine to a large number of people in controlled conditions and measuring its effect. Usually, scientists wait uh, 14 months to monitor effectiveness and possible side effects, which is why we may have to wait until next summer. Coronavirus vaccine trials face the following dilemma. We need a treatment quickly, but we also need to know it will work. The worst outcome for the medical industry would be a vaccine that either did not work or worse, was harmful or had side effects. Globally, faith in vaccine is already at all-time low. Decisions are taken by governments in tandem with the ethics committees. Every day they delay the development or introduction of intervention found effective. A growing number will die. There have so far been 19,603 deaths, with 12% of those deaths occurring in a single day yesterday. The economic devastation being lot must also be considered. This will cost lives through depression, suicide, and other effects of deprivation. In a pandemic, time is not only money, it's lives, many lives, many lives. Yet, even promising possible treatment can provide to be ineffective or even harmful. Remdesivir, chloroquine, ritonavir, and interferon all have serious side effects, including heart arrhythmias and possibly death. Indeed, a man in Arizona died after ingesting chloroquine, believing it would protect him from COVID-19. In terms of vaccine discovery, there are plenty of ways authorities could speed up the process. One is a human challenge study. This involves deliberately infecting person with the coronavirus to look at how the virus behaves and using that evidence to find the most promising vaccines. Today, healthy people are deliberately infected with the flu, common cold, typhoid, malaria, dengue, fever, and streptococcal infections to study the disease and more rapidly develop vaccines and treatments. Challenges studied have been proposed in COVID-19. A vivo, a clinical research group in London, has attracted more than 20,000 volunteers willing to be infected with a milder coronavirus, and that does not cause serious symptoms. They will each be paid 3,000 um, 3,500 pounds. However, the utility of studying relative related virus may be limited. There have been suggestions of challenge studies infection, younger participants at low risk of complication with COVID-19. This comes with danger and profound ethical implications, but could save thousands of lives. Another alternative would be to conscript low-risk people likely to be exposed to COVID-19 anyway to vaccine trials. A benefit of this would be to occur a large sample group, so helping to indicate whether treatments could be rolled out to large populations. It's notable that China's vaccine testing will occur within a military installation. The suggestion is that trials may be conducted on soldiers without consent. This war will require rights to be drawn. What level of uncertainty to accept? Whether research can be done on unconscious patients without consent? What level of risk is justifiable? And so on. Currently, these decisions are usually made by ethics committees using guidelines developed for non-pandemic situations. We require leadership from the government to push ahead scientific research around all treatment options while ensuring reasonable risks. In my opinion, a failure by government to support this research is as long as implementing harmful policy. How quickly we develop a treatment or cure will depend on the risk we are prepared to test. So far, Western countries have given greater priority to liberty and rights than Eastern countries in responding to coronavirus, leaving them less able to secure public health. It is now most likely too late to eliminate the virus with isolation and quarantine. Scientific research looks the most promising option for resolution to this pandemic. We need to learn the race by the rules in order to sufficiently protect human participations. But there is a balance to be struck. Let's not learn it with one hand tied behind our back. Uh, uh, I said about human trials of COVID-19, and I think that we should hurry up, but we should keep the rule. It's a dilemma, uh, but we should be very hurry up. Okay, Thank you very much for listening my word.